And good morning to you all. This is another session with Dr. Munné, Coffee with Dr. Munné. Good morning, Dr.
Good
Munné.
morning, Adrian. Hi, everyone.
It's good seeing everyone today. This morning, we are having a conversation about a bone graft. So let's get to it. Doctor, could you tell us a little bit about what is a bone graft and where can you use it?
Great question. And actually, thank you to our listeners. Hello today also. And I think it's a great question. So thank you for bringing it up. And a bone graft is actually a material that is placed when we want to grow bone. So it can be placed in many different circumstances, but anytime that there's bone loss and we want to grow that bone either back to the volume that used to have before, or maybe around the tooth, or in an area like a sinus graft that we want to be placing implants, that's when a bone graft is used. I want to make a differentiation between a bone graft and a bone transplant. A bone transplant is when we're taking bone from the same patient and we place it into the another area. So let's say a bone transplant in the mouth could be that we took the tissue, the bone from the tibia, which is in the leg, or from the hip, or from a different area in the mouth. Sometimes we have done auto transplants from the chin into an area in the back, or from the back of the ramus into a different area of the mouth. Those are considered to be bone transplants. Is live bone, it has cells. Now a bone graft is not live bone. It does not have cells. It can come from human bone or different kinds of bone, but is actually extracts of the inorganic material. That would mean the calcium, the phosphates, hydroxyapatite, and a lot of different inorganic materials, minerals that are contained in the bone. It can also have maybe some proteins and some other, components, but it's not going to have any cells. It's not going to have any biological material and any DNA, let's say, from yourself or any other patient. So that's a bone graft. Bone graft is a filler, and then our own cells that grow bone, those are called osteoblasts. The osteoblast, which is the cell that grows the bone, is going to grow into the area where that bone graft is and is going to take that bone graft, let's say, eat it and incorporate it into their matrix, and that's how the bone is formed. So it's a technique, a material used in a technique to grow bone. It's not the only material used because there's other things that can be used in combination with that bone graft. We use sometimes membranes that are barriers and some other biological materials that are going to be combined to get like excellent bone, some growth factors, etc., etc. Now, when is that going to be used? Well, it can be used in many different circumstances. It can be used when we have bone loss around our teeth. That would be a case of gum disease. It can be used for patients that they lost a tooth and that bone shrunk. So that's called ridge augmentation. Those are other cases of the use of bone graft. It can be used in combination with an extraction to maintain the bone. That's a risk preservation. And for sinus graft, etc., etc. It has many uses, and today is a very proven, technique that if done correctly, it works very well, and it can help a lot of patients get the desired results and get their treatment done.
Thank you, doctor. That's that's an information that is very, very useful for some of the people, some of the viewers. And we want to take a little moment to thank, some of our viewers there. Thank you guys for joining in. Remember, Dr. Munné is having these sessions every Friday. We try to make it every Friday, right, doctor?
We try.
But we have a few questions. One of them we're gonna get to this, and one of the questions from the viewers and from the internet is if my bone graft feels spooky, swollen after surgery, how do I know what's normal and what's not?
That's a very good question because definitely anytime that we do regeneration and bone graft is used for regeneration, there's always side effects, and swelling is one of them, redness. So there's a little bit of swelling that happens immediately after the surgery, I would say within the first days and can go for, let's say, maximum about 2 weeks or so. That is normal. uh, you are going to have also appointments with your doctor, and that doctor is going to be evaluating the healing and see if that redness is normal or if there's anything that is considered not normal. Sometimes if there would be infection, like some patients think, well, if there's redness, that might be that is infected. Not necessarily. Now, if it's infected, there's going to be more pain, and might be also some what we call fluctuation, which means that the bone graft is spongy. It
Mm.
feels like, like there's liquid inside, or there's something that is not, so hard. And part of it is normal to have a little bit of swelling, but part of it is not. But the person more indicated to make that call would be your doctor. He's or her's done the surgery, and they know, exactly what was done, what is expected to be normal and what is not. So I would recommend, the best thing is just to go talk to your doctor if you think that there's not something that you're concerned, and request a visit, and they'll check and let you know.
Thank you, doctor. And one more question that we have from people on the internet is it normal to see a ghosty white tissue after surgery?
Well, um, there's a part of seeing something white that's normal, and there's a part that is not. So let's differentiate. So some techniques, especially when working with, let's say, fresh extraction sites, when we just took a tooth out and now we're placing bone graft. Well, one of the techniques used to place that bone graft in that socket, or let's say that hole where the tooth was, is that we're going to place the bone graft, but then that bone graft has to be covered, right? Because there's that hole on the gum, and that bone graft can be dislodged. So some of the membranes that are placed on top, they're white in nature. Some are dissolvable, but some are actually non-dissolvable, and that white stays there, pretty much for the whole healing. And the gum is going to breach and go below that membrane until it completely closes. So seeing the white there, and it's like pretty bright white, is normal because it's a membrane, and it's just the color that the membrane has. So in that case, I would say that is normal to have, and it's expected to stay white throughout the whole time that the membrane is in place. Now, if it's just the gum and the gum turns white, that's not normal. The tissue has to have stitches, of course, to close the wound, and that wound is supposed not to have any tension. When those stitches are placed, the tissue has to stay pink, and that means that it has nice blood flow. If there's some tension on that flap, or something that happened to that flap that caused that vascularity, the blood supply of that flap, to be compromised, then the tissue might become whitish or white, and that might be a problem. Sometimes it's something that can, be compensated. Sometimes it happens only in the surface of the gum tissue, but if it penetrates the whole thickness of the gum, then can cause a perforation and complications like infection or loss of the bone graft. So just more serious complications. So I would say, if you go to your appointments, if you have any concern with your doctors, just make sure you address them, but your doctor should be able to see. So that would be the part of white that is not normal.
Thank you
Great
so much.
questions.
Thank
Thank you
you.
for asking that.
Thank you, guys. Please don't hesitate to leave your questions below. Visit our site, Healthy Gums for All. We post blogs weekly on this information. And this, if you have further questions on regards to those topics, please don't hesitate to reach out to us. Thank you so much, Dr. Munné.
Yes, and happy Halloween.
Happy Halloween.